Hello everyone, welcome to another topic. So today we are going to discuss mainly regarding TNM grading of carcinoma breast. It is a very important topic both for final MBBS students, PG entrants, and now we will see how to remember TNM grading of carcinoma breast easily. So first thing you need to have, you know that T for tumor, N for node, and M for metastasis. So whenever we are dealing with TNM grading, first we need to look at the size of the tumor, the size of the breast lump. So if it is something like less than 2 centimeter, it is your T1. So again, T1 is subclassified into three things. So less than or equal to 1, 1 mm is your T1 MI. Then more than 1 mm but less than or equal to zero point 0.5 centimeter is your T1A. Then zero point 0.5 to 1 centimeter is your T1B. More than 1 but less than or equal to 2 centimeter is your T1C. Now, as we have discussed, less than 2 centimeter is T1, whereas more than 2 centimeter but less than or equal to 5 centimeter is your T2. So this is your T2. Now, more than 5 centimeter will come under T3. Again, so there is another thing called in T, the last one is T4. So again in T4, we have four subcategories. T4A means you can remember A for under. So A for under. So it is nothing but your what is there present posterior to the breast. What is there posterior to the breast? There will be chest wall. So whenever you have got a chest wall involvement, that will constitute your T4A. So there are three important things you need to remember which constitute chest wall according to the TNM classification that goes by the mnemonic SIR, sir. So S for serratus anterior muscle. So S for serratus anterior muscle. Then I for intercostal muscles. Intercostal muscles. Then R for ribs. So either of these three are involved, it constitutes your chest wall involvement and it will come under T4A. Then next is your T4B. So what is T4B? B for Bahar, outside the breast or anterior to the breast. It is nothing but your skin involvement. So whenever you have got skin involvement, again there are three important components you need to understand. So it goes by the mnemonic pus, PUS, pus. So P for PUD orange appearance. Then U for ulceration. Whenever you have got ulceration over the skin over the breast lump, it comes under T4B. Then S for satellite nodules. So again, what is satellite nodule? Let's say for example, you have got a breast lump here within 2 centimeter radius. Within 2 centimeter radius, you have some other nodule kind of a thing. So that will constitute your satellite nodule. So you need to remember less than 2 centimeter radius. Then this is your T4B. Now T4C. If both chest wall and skin are involved, it constitutes your T4C. So it is nothing but your T4A plus T4B. Now, what is T4D? It is nothing but your inflammatory breast carcinoma. So, inflammatory breast cancer. So, again, what is inflammatory breast cancer? It is a characteristic entity where your entire breast is enlarged. So, there is no palpable lump here. And you can see when will you call that a particular entity is called inflammatory breast carcinoma means when more than one third of the skin of breast is involved. So when more than one third of the skin is involved, then it is involved with inflammation. That is called your inflammatory breast carcinoma. So this is regarding your T grading of the carcinoma breast. Now moving to the nodal grading. So how can you understand nodal grading? So you need to see, you know, breast has got majority of the lymphatic drainage going to axilla. Around 85% will go to axillary lymph nodes. Then what are the other lymph nodes? You have few going to your internal mammary lymph nodes. So apart from this, if there is spread of cancer from axillary lymph nodes to the other lymph nodes like your infraclavicular, supraclavicular, you need to remember four groups of lymph nodes here. Let's say for example you have got axillary group of lymph nodes enlarged and they are mobile. No matter how many lymph nodes are enlarged, it doesn't matter. Only if they are enlarged or not and whether they are mobile or not, freely mobile or not. So it will constitute your N1. Then let's say for example you have got enlarged lymph nodes, but they are fixed lymph nodes. So all the lymph nodes are fixed. So they will constitute to your N2A. Now let's say for example there are no axillary lymph nodes, but only internal mammary lymph nodes positive. That will constitute your N2B. Now, let's say for example, both the axillary lymph nodes and internal mammary lymph nodes are enlarged. So that constitutes your N3B. Whenever supraclavicular lymph nodes are enlarged, that is your N4. Sorry, N3C. There is no N4, N3C. Now, let's say for example, whenever you have got infraclavicular lymph nodes enlarged, that will constitute your 3A. So, when axillary lymph nodes are enlarged and they are mobile, it is your N1. When they are enlarged but fixed, that is your N2A. Whenever you have got only internal mammary lymph nodes enlarged in the absence of axillary lymph nodes, that is your N2B. Whenever you have got infraclavicular lymph nodes, it is N3A. So axillary lymph nodes and internal mammary lymph nodes both are enlarged. It is your N3B. Okay. So this is regarding your N grading. Now coming to metastasis, whenever you have metastasis positive, it is M1. Whenever there is no metastasis, that is your M0. Now the next part you need to remember is staging. So if you understand grading, it is easy to understand staging. Let's say for example, you have got T1 N0. That is your stage 1. Let's say for example, you have got T2 N0 or T1 N1. That will constitute your stage 2A. Then let's say for example you have got T3 N0 or T2 N1. This will constitute your 2B. Okay. Now I'll tell you how to remember this easily. Then the next one is, let's say for example you have got everything else and also your T1 N2. So T any all others will come under this 3A. Okay, 3A. Then whatever may be the n, so it can be any n, but it is T4. It will constitute your stage 3B. Then whatever may be the T, so it can be any T, but you have N3. It is your stage 3C. Now, whenever you have got metastasis positive, that is M1, it will constitute your stage 4. So now you need to understand, based on the staging, all this either T1, T2, T or 2B. So stage 1, stage 2A, stage 2B. Both all these three entities constitute something called EBC. EBC are nothing but early breast cancer. Now, 3A, 3B, 3C will constitute something called LABC. What is LABC? Locally advanced breast carcinoma. Locally advanced breast cancer. Now, whenever you have got stage 4, that is nothing but your metastasis, it is called MBC. So, metastatic breast cancer. Metastatic breast cancer. Now, how can you remember this easily? Let's say, for example, if you sum 1 plus 0, it is 1. That will constitute your stage 1. So 2 plus 0 is equal to 2, and also 1 plus 1 is equal to 2. So if the sum comes as 2, it is your stage 2A. 3 plus 0 is equal to 3. 2 plus 1 is equal to 3. Again, if the sum comes as 3, it is 2B. The exception is only T1 and 2. Even though the sum is 3, but it comes under stage 3A. If you see T4 in your T grading, it will constitute your 3B. Whatever may be the T, if it is nodal 3 grading N3 grade, it is your stage 3C. It is very important to understand stages, because your treatment of breast cancer will depend upon early breast cancer, or whether it is local advanced breast cancer or metastatic breast cancer. Let's say for example you have got early breast cancer, you can go for direct surgery. So you can directly go for surgery followed by post-op, so followed by adjuvant therapy. What surgery you can do is, again it depends on, it has so many criteria. So at least you remember, if it is early breast cancer, directly you can go for surgery followed by adjuvant therapy. For example, if it is local advanced breast carcinoma, you have to go for neoadjuvant chemotherapy. What do you mean by neoadjuvant? Before surgery you are giving. So if you will go for neoadjuvant chemotherapy, after neoadjuvant chemotherapy, you will reevaluate the patient, then you will go for surgery. So first you will go for neoadjuvant chemotherapy followed by surgery. And metastatic cancer is nothing, you can't do much here. So you have to go for palliative. So palliative therapy, palliation. So this is the most important TNM grading and staging of early breast carcinoma. Sorry, this is TNM grading of carcinoma breast. Thank you.